Good morning, you all. Welcome to Pediatric Grand Rounds. It's a real honor for me to be able to introduce Dr. Diane Hupp, the president of UPMC Children's Hospital of Pittsburgh, who's going to give our Grand Rounds presentation this morning. I'm delighted to be able to tell you just a little bit about Diane and her accomplishments. Although we know her well, there may be some things that you don't know about Diane that I'll be able to share this morning. Thanks all for coming in person, and thanks for tuning in virtually. Diane has spent her entire career at UPMC Children's. Prior to becoming president, she served as the chief nursing officer and the vice president of operations, and did so for nearly 20 years. In these roles, she led initiatives for patient care design, technology enhancements, and training, both at the Oakland campus and, of course, here in Lawrenceville. She also led significant advances in surgical practice, patient safety, and education and professional development for nurses. And this work has been essential, really, for our designation as a magnet hospital since 2012. That's a big deal. As president, Diane has continued this commitment to excellence by fostering improvements in the quality and safety of our care and expanded the reach of UPMC Children's Hospital throughout Pennsylvania. Her expertise made all the difference in our response to the COVID pandemic, and I will be forever grateful to Diane for vaccinating just about everybody in our institution. Her leadership in a crisis being tested again now as our volumes continue to increase here in Lawrenceville and throughout the state, and as we work through a variety of governmental directives that are affecting how we care, how we teach, and how we discover. We very much appreciate her wisdom and support. Diane received her bachelor's degree in nursing and master's degree in nursing administration from Duquesne University and her doctorate in nursing practice from the University of Pittsburgh. She received the inaugural chair for nursing excellence at UPMC Children's Hospital and was inducted into the elite American Academy of Nursing for her contributions to the profession. In addition to her many leadership roles at UPMC Children's and the UPMC system, Diane serves on several local and national boards and is currently the chair of the Duquesne University Board of Directors. For these and other accomplishments, Diane has been recognized by the Patricia R. Rooney Award for her contributions to the community. This morning, Diane will give her State of the Department address and share her vision for our institution. Please join me in welcoming Dr. Diane Hupp.
Thank you, Terry, for that generous introduction. And it is my honor and privilege to be here. I'm not here that often when I see so many of our colleagues here from the pediatric world and our physicians and providers. So I thank each of you for being here today. To maybe some of this I'm hoping that you know about, but there's a lot that's going on. And just day to day here, the activity, the accomplishments, and what we have to look forward to the future is probably what excites me most, despite the challenging times that we have. Terry, I really appreciate that introduction. I would say if anyone knows me well, you know, what I'm most proud of is being a nurse here at this children's hospital. And why is that? Not only the impact that we as, whether you're a provider or a nurse or clinician or therapist, can have upon our patients and families, but it is to be able to be privileged to work with the incredible individuals that work here. And that includes every one of you. And in particular, since I'm speaking to our providers and our physician and our faculty today, I'm grateful for each of you and applaud you for the work you do. So a big thank you. Doctor's Day is coming up just in about 10 days. So for all of our doctors out there, providers and medical students, residents, fellows, happy Doctor's Day a week or so early. Grateful for your efforts here at the hospital. I start with a bit about our vision, and you've seen this before. Certainly not going to read this. This is our roadmap to the future. There's a lot on here, but pay in particular attention to the goals that we have. They are focused on our people, our patients, how we'll continue to grow ourselves, while doing that by being one of the safest hospitals in the United States. To me, safety and quality trumps about everything. Working in a hospital, if we can't be safe, we can't deliver quality care, we're not the top children's hospital that we are. And we certainly are that. But we need to continue to not rest on the laurels and continue to put that front and center. I also share the lofty goal of continuing to be a leader in innovation and research, which I know right now is a challenging time for many of our scientists and many of our researchers. I want to start with and share with a few of our organizational accomplishments. And primarily, this is just from the past year. Each and every year, there are many accolades and accomplishments that occur through the years, but I share with you a few of them. I know you're aware of the honor roll. It's important to us. It's a representation of quality and safety and reputation. And last year, it was a disappointment to myself, and I'm sure to many of you, that we didn't hit the top 10. I will share with you, though, we were very close, very close. It is an extremely tight race out there. I am proud that we were able to deliver in all 11 specialties, and we were ranked in every one of them. I share with you that we just hit the submit button. I want to thank Gabriella Butler, thank all of our division directors, Dr. Bucher, Dr. Ost, Dr. Dermody, and many of you who have helped to help us to submit that submission just last week. We won't know anything until the fall. So we will hear more about US News in October. But special thanks to all of you who are part of that. I also share with you that in the calendar year 2024, in addition to the Best Children's Hospital, a lot of other accolades. We were recognized by the International Lactation Consultants for getting awarded. It is the gold standard for particularly children's hospitals and newborn nurseries for our ability to be able to work with our moms on breastfeeding. And we're proud of that. That was the first time that we received that award. Special thanks. I see some of our NICU colleagues here today for the work you do with the nurses. We were one of 8 hospitals in the country to receive Leapfrog. Only 8 children's hospitals. And that's a pure testament and focus on quality and safety. Our APPs, Whitney Lurch and her entire group, got us the accreditation with distinction. One of the first in the nation for the work that we do with our fellowship. Our pulmonology folks in CF, our sedation folks received Center of Excellence. Our NICU and our PICU, both this year, received the Beacon Award. First time in the history here that we have been able to receive that. The Beacon Award for Excellence is a testament to the quality outcomes and all we do for our patients in those 2 units. So kudos, a lot of organizational achievements. It's not about one person or one division or one group. It's about all of us. But despite those accomplishments, there are a lot of challenges that we have in moving forward. We could spend today talking about the challenges, but we'll quickly shift and turn to some of the more positive and some of the exciting things happening in the future. But to name a few of these, the healthcare headwinds do continue, in particular with access, and in particular with equitable access to all of our children who need us. The pediatric demand continues to rise, while the workforce is shrinking a bit. Now, here at Children's, I would say we're pretty fortunate in terms of the ability to fill many of our positions, not all. But when you look at the hospital side, Paul Ike, our chief nurse here today, has done an extraordinary job in filling our nursing positions, unlike many other hospitals across the nation. We're about filled with a very low vacancy rate. When you look at therapists and some of our technical side of things, such as a respiratory therapist, a surge tech, a rad tech, those are the areas we're struggling in. And we need to partner. We are partnering with high schools and tech schools to bring them in to try to shadow and fill those slots. Certainly from the pediatric workforce, I don't need to tell you that more so in the Department of Peds and on the surgical side, but still we have some vacancies there. And we're working hard, in particular, my communal, Terry Dermody, all the division directors, to recruit. We've basically said, go out there and recruit. Bring it back to Terry, we will make this happen. And accolades to some of our divisions this past year. You know, I want to give a special shout out to Dr. Jeff Rudolph and all he does in his division for the recruitment that he's done to help with the workforce in GI. It's a big lift, and there are many others of you out there. So thank you. The reimbursement and funding, I know you're all aware, it's not only on the medical side for the healthcare that we provide that's diminishing, but it's clearly the dollars that we utilize for our research right here in our Rango's Research Building. We're aware, we know, we are doing our best. Just had conversations yesterday with some of our foundation colleagues that, you know, depending on what happens, how we will do our best to fill the gap. It's important that we continue to innovate and use science to give hope for the future of our kids. We also know there's consumer preferences, and that impacts us. Patients and families want seen now, today, at this time, or on this day. I'm proud our access is improved, but it is a challenge to meet the consumer's preference day in and day out, and we do our best with that. We know we have some slots open. Doesn't always match. We know that patients coming in our emergency department or coming in there and probably could be seen in the CCP or pediatrician's office, but they want to come at 7 o'clock tonight, and they want to come here. So the consumer preferences are driving some of what our strategic vision is in delivering care. Rising costs, the inflation that we've seen over the past few years has been unprecedented, certainly has taken a toll also on the margin in healthcare and hospitals across the United States. These are just a few. So I shift to what we can control. Some of those, it's hard to control. We're not going to control so much the rising costs. We're not going to be able to control if the NIH funding gets decreased. But we can control and focus on quality in the delivery of care that we give every day here. We can focus on how safe we are, how we utilize best practices, and that will impact the quality that is delivered to our kids. So I ask you to keep that at the forefront. From the experience of both our patients, our families, but also the experience of our employees and our providers. We have a lot of control over that. If you walk into an environment that's inclusive, friendly, welcoming, people are more apt to stay, and they're more apt to be satisfied and happy. And we know when we have satisfied, engaged, and happy providers and staff, we'll probably stay here longer. From an access, we have a lot of control. A couple years back, we had wait lists and wait lists and wait lists. We have been able to influence and control that. To today, the report that came out this week, my goodness, we're on an average of 11 days. It's the lowest we've seen. We have been able to control that and do better. We've also been focusing on our quality as it relates to the hospital-acquired infections. Very important. Nobody wants to come into the hospital and leave the hospital with an infection that they didn't come in with. Now, some of these are tricky, and some of these, you know, depending on definitions by our national institutes, we call them. But by and large, we've made improvement in calendar year 2024. CLABSIs, we've seen about a 20% reduction, which is terrific. I will say January and February, we had a little bit of uptick. I see Dr. Green there and others. We're all over it, and Dr. Stillwell is helping with it, and we'll get this back on track. But we did see over the past year a reduction. Our C. diff infections we've been working on, it took us a while, but you can see there over the past year in calendar year 24, significant reduction of our C. difficile. Some of that has to do with our ordering protocols. Surgical site infections, we did see an overall last year, a little bit of an uptick in the middle of the year, uptick meaning 5, 6, 7 infections a month, which was, we hadn't seen that before. We worked hard to put in some best practices and working with our surgical folks, and in particular, Dr. Mellon, Duray, our VP of Ops, and others. We've been able to shift that, and you can see a significant decrease, and we hope that that sustains. Our CAUTIs and our urinary tract infections, if you look at the graph, you'd say this is a little bit inconsistent and maybe not is it statistically significant here? But what I'll tell you is the N is extremely low. When you see the high jump up, that is 1 or 2 infections. In the entire calendar year 24, we had 4 infections the entire year. So just 1 infection is going to have the graph look a little bit upside down. All in all, we're making improvements in our quality and our hospital-acquired infections. Our activity, many of you know, but I think it's nice to sometimes just take a look at the numbers here. And there's some interesting trends that I'll share with you on the following slide. Year over year, our activity is up in all of our areas. In particular, you can see our observation cases, but outpatient, express care visits. The only thing that's slightly soft, as you see, is our admissions. But what you will see if I share this with you over a long period, almost a 10-year period of time, I share with you the noted shift from acute to critical care. Our average daily census, how many heads in a bed, whether you're an admission or an observation case, when we moved in this hospital a couple years after, it was about in the 250s. We are now closer to around 270. We know we have days here that we're up over 300, almost 350 on a few days. But by and large, we're sitting around 270. But note the shift that we used to have several more acute care and less critical care. We've gone from critical care of being around 39 patients a day up to 58. That's a significant increase in the critical care and in the acuity of the patients that we care for. Our NICU census has been relatively flat. However, what I will tell you is we've done a lot of work with length of stay. So we've been able to get some more NICU babies in there. Our rehab has also grown. We moved from down the street a couple years ago to our new 12-bed unit up on the 7th floor. And we've definitely been able to see more patients up in our rehab. And I only anticipate that continue to grow. We could take up to 12. Our surgical volumes to share with you, we have 3 primary sites at our main hospital here. We have 14 ORs, our North Surgery Center, very busy, 4 ORs, seeing almost 9,000 patients a year go through our North Surgery Center, one of the busiest surgery centers in the city. And our procedure center here, which we run 3 procedure centers rooms a day. Overall, over a 2-year period, we've seen a 10% increase. That increase has primarily been in the ambulatory world. Now, some of that's intentional, but we have recently seen a decline in inpatient surgeries. Some services are intentionally moving to the outpatient world, and we want them to do that because that's the right place for the patient that can be done in an ambulatory surgery facility. There are others that we think we could have some backlogs that if we had more openings in the main and move out the ambulatory patients to the north, we could see more inpatients. And there's a group that's working on that. All in all, over the past 2 years, we've opened up 2 to 3 additional ORs on any given day that's helped us with this growth. Our emergency and urgent care, I shared with you the numbers on the earlier slide, but I think it's impressive to see how our ED pre-COVID, we're actually higher now than pre-COVID, but not necessarily in the emergency department. What we've seen the shift in, you can see 80,000 visits pre-COVID in our ED. We were at about 78,000 last year. What we have seen increase is a rise in our urgent cares, whether that be express cares. At our main hospital alone, right next to the ED, we are seeing 15,000 express care visits a year. That's on top of our near 80,000 ED visits. If you take that back pre-COVID, we weren't seeing that many. We've also added ortho urgent care. Ortho urgent care started out their first few years of seeing 10 patients a day. There are days, this past week, they saw 30 in a 4-hour period there with a provider or 2. So ortho urgent care is very much meeting the demand, and we're thankful that we have them up there on the 3rd floor, and I'm sorry, 2nd floor. And also from a behavioral health perspective, we are seeing patients every evening and on Saturdays on the 3rd floor in the alligator pod. The patients and particularly adolescents that come in needing some more urgent help with behavioral health. So looking at our types of visits, we are shifting more to the urgent express care, which goes back to the consumer demand. They want to see a provider when they want to see the provider and not necessarily schedule with their primary care doc. We're still educating on first, please call the primary care doc, let them help direct you. But consumer preferences are taking precedence. I'll move on to our outpatients and our access. I won't share too much. I know this gets shared by Mike Comey now, and I really thank him and our division directors and Terry for the significant improvement. A few years ago, as I mentioned earlier, we had long waits. On this slide, you can see we're down to 12 days. Yesterday's report showed 11 days in aggregate. We only have a couple areas and divisions that have longer waits. But I was pleased to see that I think our longest wait was about the 30-day window. It used to be 50, 60, 70 days to get in to see some of our specialists. So thank you for the work that's being done on access, and I know our patients and families are more than grateful for being able to get in to see one of our ped subspecialists. I'll shift gears for a moment on bringing care closer to home and why we continue to believe growing the pediatric services outside Lawrenceville is important. Imagine being a parent and having a child with a chronic illness that needs to see a provider once a month, once a quarter, and driving 2 and 3 hours to Pittsburgh. We have been able to grow our services and expand the footprint. These are all the areas now across Pennsylvania, and particularly up in Northwest and over in Central Pennsylvania in the Harrisburg area, that we've been able to grow services. This wouldn't have happened without our providers, and I recognize that, some of which are stretched to go see these patients. We've been able to start some minor surgeries thanks to Dr. Waltz and ped surgery team up in Erie. We've been able to start, Dale King, kudos to Dr. Dale King for our first proceduralist going up into Erie to do GI, and he's doing quite well up there. And he is our medical director up in the Erie area. Also want to say thanks to Dr. Greg Beretta up in the Harrisburg area. He's recently been appointed as medical director over our pediatrics up in Central Pennsylvania. And you can see in Central PA, we have 4 different areas. Lemoyne is a specialty clinic 5-10 minutes from the Harrisburg Hospital that has a multitude of our services. We also recently opened up a clinic just this past year in Chambersburg. And we have some services, pediatric surgeons seeing patients over in York and then in Lancaster. It's impressive to see us continue to grow. I'll talk shortly on what's next. Where do we hope to continue to deliver services? A few things on the Harrisburg and how we're doing up in Harrisburg. Few different highlights to you in all the areas where we're seeing patients, in particular the express care visits. We now have a couple express cares up in Harrisburg, and I shared with you the few clinics that we have. But year over year, CCP in primary care is up almost 17%, and the express care visits up another 7%. Our subspecialty visits, we're up to nearly 35,000 specialty care visits up in Harrisburg. If you take that back and rewind that a few years, it was a couple thousand. That's impressive. Our surgical volume also, they did very little pediatric surgery volume, but what our surgeons up there now, we hit over a couple thousand, and I anticipate that we'll only be doing more. When you look at market share, I won't talk a lot about it, but in the Southwest PA, we have 96% market share. Up in Erie, we actually have 90%, but the bulk of the patients come to Pittsburgh. In Harrisburg, we have less than 20%. This is our biggest area of opportunity to grow ourselves and to do more. So priorities that we're looking at here are focused a bit on the ED. 60-70% of the admissions to this hospital come from our emergency department. It's the biggest area. So we are working with our colleagues in Harrisburg to do more, to have an ED that looks and feels like a children's ED. We have a beautiful unit. Some of you may have been up there. It looks and feels just like Pittsburgh Children's. We have intensivists, hospitalists, neonatologists, and many of our subspecialists. But the ED, we are working to do more. We're also looking at our imaging services and ophthalmology and urology to help us cover some of the inpatient. This is the clinic that we opened just a few months ago, back in August, and the services that we're seeing up in Chambersburg. The Express Care, we just opened this January. So this was the second Express Care, does have imaging, it's open 7 days a week. And it's seeing just early out of the gate in its first month, about 10 patients a day, which is on average for what we've seen when we've opened up Express Cares around here. Moving up to Northwest PA, up in Hammett, you can see some of the key stats here, but similar, our Express Care visits continue to rise. Now, we are taking a look at the primary care because our primary care visits are down, and there's basically, we only know of one other area seeing patients in Meadville, and we get a lot of their referrals. But primary care a little bit down, as well as ED visits. But what continues to grow is the subspecialty visits. That's what we've really invested in, and that's what we've done our best to get providers up there to see the subspecialties. I mentioned the market share, 90%, with the bulk of that, about 78% out of that 90 coming here to Pittsburgh. So our goal is to say what portion of those patients could remain up in Hammett as opposed to having to make the trip down here. I am pleased to say that later this year, we're going to open a second ped specialty clinic. Some of you will be helping us out with that. We're looking at ENT, plastics, neurosurgery potentially, PM&R, and possibly putting some therapies up there, which would be very helpful because there's not any close by pediatric therapies such as PTOT speech. Also a win from the Hammett area, just hot off the press, is thanks to a lot of the folks that have been working on this with Dr. Conti and Dr. Ox and our ED folks in neurology, that we have been able to perform pediatric fast brain MRIs. And what this means is child comes in, particularly with seizures, very common. They don't have to necessarily come to Pittsburgh. They can get their MRI and they can stay up at Hammett. The other reason why, not only keeping the kids close to home, but it helps to decompress us if we can keep those kids that are appropriate in these areas. I also wanted to share this past year, we started orthopedics out at the Lemieux Center. We have a non-operative sports doctor, Dr. Tanya Mosini, and we will be looking to see who else we can help to see patients out at the Lemieux Center. And this is out in Cranberry. Wanted to mention special thanks, Dr. Mazaregas, and Paula works on this as well, Dr. Soltis, that this past year, we have a partnership with Atrium Health Levine Children's Hospital down in North Carolina. This is our third partnership for performing pediatric liver transplants. We do this in Virginia, and we also do this in Florida at the Advent Hospital, Florida Hospital for Children, and the Levine is our third. And there's a potential that we're working on as a fourth. And what this means for kids that are waiting for liver transplants is there's a supply and demand issue, as you know, with organs. And in these areas, if they have the organ availability, our transplant surgeons will go down and actually perform the transplant. Many others help to do some consulting with those children. The outcomes have been stellar. We still are the leading children's hospital in the nation for the number of pediatric liver transplants we've performed, as well as the outcomes that we deliver for our transplant folks. I also wanted to quickly mention, I mentioned the East Coast Pediatric Liver Transplant Network, but also wanted to mention that we do still have a partnership down in Florida, in Tampa, with St. Joe's Children's Hospital. It is part of the Bay Care system. Dr. Victor Morel and his team and our ICU folks perform cardiac surgery and manage the pediatric ICU. And also thanks to our infectious disease folks who are using the ID Teleconnect to perform ID consults at both Dartmouth and Children's Minnesota. What's next? In addition to the Northwest and Central PA, we are looking to do more right here in Southwest PA and Washington. As you know, this past year, UPMC affiliated with Washington, And now Washington is part of our UPMC health system. There's two hospitals, UPMC Washington and UPMC Green. Some of the priorities we're working on is to first take a look at the ED, which we've done with many adult hospitals. Most adult hospitals see on average 10 to 15% of kids in adult hospitals. What we're trying to do is bring the pediatric expertise and be sure that they have what they need to take care of these kids. Our ED affiliation, led by Dr. Steve Janoski and Mel Murray, have gone out to these hospitals. They've done an intensive assessment and then been able to identify and give recommendations on how to make improvements in these EDs, all in the interest of being able to take excellent care of any child that comes into any ED. I very much applaud Dr. Janoski and his team for the work that they've done. They have done the assessment at Washington, put forth some recommendations. Part of the affiliation is also that when a child comes in, they can courtesy call our ED and be able to say, do I really need to send this child in? Many of the kids sometimes get transferred in only to find that we see them here and we discharge them. So could we help them and keep the child in their own ED and discharge them? We also want to be able to concierge ambulatory visits. So if a child comes in, the ED doc says they can go home, but they need follow-up visit with a cardiologist, a pulmonologist, whomever that may be, that they can have a one line to call and within 24 hours be able to get that appointment scheduled. We're also looking at aligning pediatric primary care. There is a primary care pediatric group out at Washington, and we've met with them, Dr. Hoburn and myself, and looking to align their pediatric practice and therapies that they have. We're looking at we have a specialty clinic right at the Washington Hospital. It's been there for many years, but we hope to bring more. Orthopedics is first out of the gate and willing to go down and see patients, and we will continue to look at what else we can offer to help those patients in the community. We'll also evaluate if we're able to do any type of ambulatory surgery. There is an ambulatory surgery center out that way that Washington utilizes, and that's a potential for our surgeons. At the East Satellite, we have acquired a new suite. For those of you who work out in the Monroeville, I know it's tight. We've been asking for more space, so we've acquired more space. And Mike Communal has worked with the division directors in GI, rheumatology, and genetics to get a little more space and see patients. We're also expanded ophthalmology into some CCP space that CCP had during the evening, and we're going to make use of it during the day. So these are just a few of some of what's next in terms of future growth and work by our providers that I know will be appreciated in those areas. Speaking a few moments on PEDS behavioral health, I mentioned our behavioral health walk-in clinic that's seeing patients every evening and on Saturdays. I did want to share with you and very much thank Kristen Straka, Dr. Delope, Dr. Abby Schlesinger, and those that work in this space. We know that the demand is real. Over the past 2 years, since we said we're going to put this a little more on the front burner here in doing our best to help to support these patients. Some of them are young children, many of them are adolescents. These are some of the accomplishments just in 2 years. When you look at avoidable hospital days, these are teens primarily that are sitting in the hospital waiting to go to an inpatient setting. We've been able to cut that significantly in working with partnerships, particularly with Western Psych, but also being able to manage them more in an ambulatory setting. The decrease in transfers to Western Psych, go back a few years, it used to be a child we had that had a behavioral issue, a concern, just send them over to Western Psych. We realized that's not the right thing to do. We don't need to send every child over there. We can manage some of them through some of our ambulatory settings and offerings that we have. Our behavioral health, since its inception, has treated over 1,000 patients. We've added 13 new positions to support integrated behavioral health, and I'll share that with you in a moment. And I know that continues to grow. We had about a dozen of them, and now we're up to close to 26, 27, 28, and counting. Our clinical liaison consults, and this is the work done by Dr. Delope and team, has increased significantly, and I know it's needed. We're working with our foundation to help us to do this. And I very much thank our president of the foundation, Rachel Petroselli. I see Nicole here today. I thank our foundation. Most recently, just a few weeks ago, the new FNB hub downtown put forth $1 million to provide family support for a hub, particularly that's going to help support technology-dependent children and their families. Dr. Schlesinger had mentioned this at one of the physician leadership meetings, and the two divisions that we're beginning with are supportive care and also peds surgery. And what this will do is a family support partner is an individual who's more or less can be a peer to these parents, who's gone through this, who's lived it, has the experience to provide peer support, information, and just help and support to these families who it's a real struggle. These are the specialties in which we have behavioral health embedded. You can see there are many. Take this back 2 or 3 years, it wasn't near the number. And I know there's a continued request out there to grow behavioral health in our subspecialties and integrate that so that you, as the pediatric specialty provider, are taking care of what you need to take care of, but yet you know they need some more help. And if we can put more of these individuals in the specialty clinics, we know that the integration works and will just help these kids and these families so very much. So we continue to invest there. What's next for behavioral health? We just last month or in January did begin seeing patients at South Fayette. We'll continue to integrate them into our specialty care. I mentioned the FNB peer family support positions. We are also looking at the 4th floor out at South Fayette. As you know, if anyone is at our southern tier there, our southern hub, we have a 4-story building. 3 of the floors are full. The 4th floor is a shelled floor. We are looking to evaluate what we could build out. We know capital is a premium right now, and there's a lot going on in our health system with building, in particular, our Presby Tower that's going up. However, I think to start now and take a look at what this could look like and what capital it would take. And we potentially have individuals that may have interest in helping us with this from a philanthropic perspective. And whether that be adding some behavioral health services coupled with some of our medical services. So this is early out of the gate, not yet decided upon, but there is a small work group that's looking to put recommendations forth for that area. I'll move to service. When I think of all the quality and the safety and the growth, it's very important. People come to hospitals for high quality care, but they leave the hospitals with not only the quality care that's expected, because when people come to UPMC Children's Hospital, it's expected we're going to take care of their kid and they're going to go home. That is expected. But what's not as expected and makes huge differences is the service we provide, the care, the compassion, all of the little extras. Last year, we had a fairly good year. We had a good year here. Overall, this is all of the hospitals in the health system that get ranked with Press Ganey. We are to the far right. This represents 81% of our families give us a 9 or 10 on the Press Ganey survey. Now, we could probably go back and forth on our Press Ganey survey and how valid is it, how statistically significant is it. We only get 60 to 80 surveys a month, but yet we send home 2,000 kids out of the hospital a month. Totally understand it. And that would have been me about 7, 8 years ago. Now, after having gone to many educational sessions, looking at this data, I do believe that there are key initiatives that impact one's experience. And I can tell you, just had my mom in the hospital on and off for a month. It makes a difference. These small things make a difference. Of course, I want the quality of care to be there, but the service and the compassion, and most of all, the communication that is given by our providers and our nurses and our frontline staff makes a difference. Paula is doing a lot of this work with the nursing group. We have a physician group led by primarily Dr. Urbach is out there doing observations. Thank you, Dr. Urbach, and working with our physicians, Dr. Bucher, Dr. Ost has been this, and many others to help us with the delivery of service. Last year, we had a bit of an up and down, but generally speaking, we saw an uptick year over year. We've put out some key tactics for physicians, and I know you say, does it really matter if I sit or I stand in a room? Does it matter if I go in as the attending and speak? I know we're a teaching facility, but many of our families want to hear from the top doc who's taking care of their child. Eye-to-eye communication that Dr. Rudolph has helped to lead, appreciated. Little things like the communication boards. At the end of the visit, is there anything else I can answer for you? I have time. Even though you probably don't have time, but that statement makes a difference. These are small little things that make a difference. This can only be done by the people here. And it's not just the physicians, it is nurses, therapists, environmental, dietary, every single person that goes in and out of the rooms, whether it be inpatient rooms, outpatient settings. I'm pleased to say that we've had a decrease in our turnover. We're retaining more of our frontline staff. From the hospital perspective, you can see here, this represents last year, we were able to keep 87% of our staff. We had a 13% turnover. When you look at national benchmarks, it's about 20%. When you look at nursing, which represents a large portion of our staff here, kudos to Paula and all of the nurse leaders. Our turnover was 8%. We kept 92% of our nurses. Average turnover for nurses is high. It was about 18%. In our health system, it's about 16, 18%. So we're doing quite well. If you look at first year turnover, that's the opportunity that we have, is keeping our first year employees. Overall in this hospital, I'm not proud to say, but we do lose about 1 in 4 or 1 in 3 if they're a new hire. So we have a task force that's looking at this, trying to make a difference. I want to share a few minutes on innovations and investments that we've made. The Heart Institute. You can't help but see that when you walk over our Rainbow Bridge. This is a picture from just this month, March. It is going up, the steel is up, the floors are going up, the stairs are going up. We're very excited to see this $85 million investment go up. The timeline is next year at this time, I would hope by April, if all goes well, we will have the 3rd and the 4th floor built out. So the 3rd and the 4th floor, particularly the 4th floor, would be our brand new cath labs. We are building out 3 cath labs and a cardiac MR. The 3rd floor is a dedicated entrance. It also has a lot of support space, an educational and conference center. There's annual symposiums, international conferences that are done by our cardiology folks, and they're excited to have this space. This is a destination center. It's more than another building. We want this to look and feel for children coming in for heart care, that it's their own space. The 5th floor will also be built out, and that is a change from the original plans. The 5th floor, eventually, the following year in 2027, we will be moving over our cardiology clinic. So as you know, on the 3rd floor here in Hippo, we're going to move over that clinic. We will also be looking at a cardiac rehab and putting in a cardiac rehab space, which we don't really have that today. They'll be doing their echoes there. When it all gets done in April 2027, it will be a beautiful building delivering state-of-the-art care for our patients with heart diseases and conditions. But again, next year at this time, I will hope that we are just about near a ribbon cutting for the 3rd and 4th floor, that we can begin doing these cardiac casts. There'll be pre-op space, post-op space. The bridge that will take you from the building crosses over. You probably see it being constructed now, will be over, and it will open up by the operating rooms towards the CICU. I also wanted to mention that we did put in a new CT scanner, $4 million this past year, and it was an investment. lower dose radiation, higher quality images. Cardiac is using this as well as many of our other services. We also replace monitors, and it seems like we just have to do these things. But when you look at the price tag, it is a bit of a wow, $11 million to replace our monitors. They're all replaced, just about getting finished in the operating rooms, in the EDs, in the inpatient areas, all the way around. I also mentioned from an innovation perspective, bridges. This is a clinical transformation. I thank Dr. Suresh. She's helping to lead this from children's perspective. Timeline for bridges is coming up. Later this year, we will be rolling out phase 1. Now, phase 1 is not in particular, Children's Hospital is in phase 2, which is next year, around the fall, well, May timeline. Is that right, Suresh? About May for us next year. But we will be impacted later this year when phase 1 hospitals go live because of our clinics. So Dr. Suresh is working on that. And there are some clinics when we see patients up in Hammett that will, because Hammett's going live shortly, and we will be impacted because of our clinic up there. So we are working through that. Suresh is working through that from the clinical end and is our lead. I also wanted to congratulate and say thank you. Just recently, many of you probably know from Terry that our Department of Peds came 15th on the 2024 Blue Ridge rankings, which is kudos to all of our researchers. And in particular, 9 of our researchers were able to secure over $1 million. Kudos. Our top 3 that I understand came in at the top 3, Dr. Dermody, Dr. Alcorn, and Dr. Celadon. So I congratulate you for the work you do and the skills and abilities to be able to bring in that funding and help elevate ourselves in these national rankings. I know it's not easy. What I hear is, I don't know firsthand, but I'm talking with our scientists, and I was up in the lab about a month or so ago, just touring around with one of our researchers. It's harder and harder on what you do and how you're able to be funded. So I thank you for your efforts, and I congratulate you on that. When we look at our goals for next year, I mentioned many of them and won't read these to you. We are very much hoping that we get ourselves back in the honor roll, but we also know that honor roll is hard to study for, let's say. Questions change each year. Volumes make a difference. Reputation makes a difference. Our focus goes back to the slide that I showed you, intense focus on what we control, and that's quality. Quality, quality, quality. I feel if we do the quality and the safety, much of our points in many of our services, we slipped in a few of them this past year, and all of those that are engaged or involved in working hard. Some of it has to do, though, with numbers. It's not that we had a really bad year, but when numbers are smaller and we have a couple deaths here, or we possibly have a couple more infections here, then it's going to impact us. From a people aspect, certainly recruitment and retention of not only our hospital staff, but of our providers and our APPs. We want to continue to focus on that. You will receive a My Voice engagement survey as you do each year. I know Terry and I and other physician leaders are grateful if you complete that, because we'd like to hear from you. I know we hear from you in many different ways, but this is one opportunity that's confidential that you're able to give us your feedback. I spent a lot of time on the growth. Certainly that will continue to be one of our areas of focus. And then I mentioned the innovation and the research that will continue to do our best as hospital leaders to support those of you who are in need of support. There's a big list. We know that we can always be looking at how we get more funding to perform research and science, but we will do our part. I'm committed to that. I've been working personally with Terry over the past year to enable us to do our best and put our foot forth to say, let's do what we can. The hospital had a pretty good year last year here at Children's, and how can we continue to invest in our scientists? I close with a thank you. I close with a thank you for what you do every day here, for the differences that you make, for the partnerships that many of you are to me as a leader. I believe you are only as good and successful and can achieve accomplishments with those of you who you surround yourself with. And you are the people that make Children's this very special place that it is. So I'm grateful and honored to continue to serve in this role as president. I know we have a lot of work ahead of us. I shared with you much of that today, but I'm also confident that with the incredible team here in leadership and committed folks, you dedicate your lives to improving the lives of these kids. And if you come to work and focus on the mission every day, we will continue to do better and continue to elevate ourselves. So thanks to all of you, and I would be happy to take any questions at this point.